Susan Hart takes painkillers every day to cope with a knee injury. It happened last winter, and she spent 4 months at home waiting for an MRI to diagnose the problem. She got tired of waiting.
I mean, at this point, I'm desperate, honestly.
That desperation drove her to spend more than $1,100 for an MRI at a private clinic. The clinic gave her the results on a disc and a diagnosis: torn meniscus. She'll need surgery to fix it. She would have waited another 6 months if she stuck with the public system.
I mean, I think it's a blessing and a curse. It's a shame that there needs to be clinics like this, I guess. But at the same time, it gives people more options.
Ottawa says this should not be happening, and it has told the province to ensure that MRIs and ultrasounds are publicly funded. Over the last 2 years, it's clawed back more than $3 million from Nova Scotia's health transfer payments as punishment. Meanwhile, private clinics that offer diagnostic imaging are multiplying. For many years, Nova Scotia had just one, but a second opened last year, and a third is slated to open later this month. This radiologist founded the company that opened an ultrasound clinic in Halifax last summer. He already had more than a dozen clinics across Alberta and Saskatchewan. He says he was drawn to Nova Scotia for this reason.
Mostly because we learned that there's a very, very long wait time.
Political scientist Taryn Grant says one way Nova Scotia could resolve this issue would be to publicly fund the private clinics. Other provinces have done exactly that.
It would be a fairly relatively simple matter to establish contracts with these facilities such that they are being paid directly by the province.
Madubobi says that's how his other clinics operate.
In the long term, it's always beneficial for patients and likely for even the province financially, because then people would just get care earlier rather than wait later, and then the cost mounts up.
Nova Scotia Health Minister Michelle Thompson would not do an interview, but her department says it's working with Ottawa on a solution. If it finds one, it could get the money that was clawed back reimbursed. Taryn Grant, CBC News, Halifax.